Good morning, everybody. I talk about your randomized trial of posaconazole and benznidazole for chronic chagas disease. Definition: Chagas disease, a chronic parasitic infection caused by the protozoan Trypanosoma cruzi, is considered one of the neglected tropical diseases. Although Chagas disease was identified more than 100 years ago, current therapeutic options for this condition are primarily limited to benznidazole and nifurtimox. In light of these problems, the safe and most effective therapeutic options for the patients with Chagas disease are clearly needed. Many candidate drugs are currently being tested, but levodosterol synthesis inhibitors are particularly promising due to their antiprotozoal activity, the stage of development reached, and their safety profile in humans. Posaconazole is an antifungal agent of the trazole class that has been approved for the treatment of the invasive fungal infection in humans.
Chagas disease, also known as American trypanosomiasis, is a disease caused by a group of parasites called Trypanosoma cruzi. Chagas disease is named after Carlos Chagas, a Brazilian doctor who first described it in 1909. African trypanosomiasis is a different disease caused by Trypanosoma brucei. It's estimated that about 6 to 7 million people around the world, mostly in Latin America, are infected with this parasite. About 10,000 people die each year because of this disease. Let's have a look at how this disease is transmitted. People can get infected in different ways. The most common way is through several species of blood-sucking insects called triatomine bugs. These insects get infected after biting an infected animal or person. The bugs tend to live in crevices of walls and roofs of houses, most commonly in houses that are made of materials such as mud, straw, and palm thatch. They come out at night to feed on people's blood when they're sleeping. Because they tend to bite people's faces, they're sometimes called kissing bugs. Now, once they bite, these bugs can defecate on the person's skin. Their feces contain the parasites, which can then get into the person's body through the bite site, through mucous membranes, or if there's breaks in the skin. The infection can also be transmitted through food that has been contaminated with feces of the infected bugs, through lab accidents, blood transfusions, organ transplants, or congenitally, from mother to baby. Let's have a look at how the disease presents. There are two main stages of the disease, an acute phase and a chronic phase. In the acute phase, symptoms generally start to develop after about 1 to 2 weeks following the bite. These are generally mild and non-specific. Symptoms include fever, malaise, headache, rash, diarrhea, and vomiting. There could be enlargement of the liver, spleen, or lymph nodes. Sometimes there can be a skin nodule called a chagoma, or a swelling around the eyelid called the romanicine at the site of the insect bite. The symptoms generally last for a few weeks or months. Some people may not have any symptoms. Very rarely, the disease could be severe in the acute phase. This is more common in children or those who are immunosuppressed. The disease then moves on to the chronic phase. In this phase, about 70 to 80% of people may not show any symptoms at all. However, in about 20 to 30% of people, the disease can progress, mainly affecting the heart or the intestine. This can happen 10 to 20 years after the initial infection. In the heart, the disease can cause enlargement of the heart muscle, leading to heart failure or disturbances in the heart rhythm. In the intestine, there can be enlargement of the colon or the esophagus. This can lead to difficulties in swallowing food or passing a bowel motion. It can also affect other parts of the body, such as the ureters. The coexistence of other diseases, such as HIV, can result in the disease manifesting differently. It's also harder to diagnose and treat. Chagas disease is diagnosed by laboratory techniques. The most common method is by detecting the parasite in the blood using microscopy and is useful for the acute phase of the disease. Because there are very few parasites in the blood in the chronic stage, other techniques such as checking for antibodies in the blood or detecting the parasites in tissue biopsies is more useful. Other methods include culture and PCR that detects the genetic fingerprint of the parasite. So, how do we treat the disease? Treatment focuses on two aspects: eliminating the parasite and managing any complications. Antiparasitic medicine can be used to kill the parasite and is most effective in the acute phase. Treating the complications of the disease will depend on the organ affected and how bad the damage to the organ is. They include pacemakers or medication for heart rhythm abnormalities, medication, changes in diet, or surgery for intestinal complications. So how do we prevent and control the disease? There is no vaccine or preventative drugs that can be taken to stop people from getting the disease. Controlling and minimizing contact with triatomine bugs that carry the parasite is one of the most effective ways to control the spread of the disease. This can be done through activities such as spraying houses and surrounding areas with insecticides, improving housing standards and cleanliness to reduce the number of insects living inside, using bed nets. Other measures include reducing the burden of the disease by good surveillance, diagnosis, and treatment, reducing contamination of food through activities such as properly preparing and cooking food and keeping food covered, screening blood supplies and organs to make sure that they don't carry the parasite, screening newborns and other children of mothers who are infected to ensure that the disease is diagnosed early and treated. And that's a quick look at Chagas disease. For more information, have a look at the websites below.
Applications in medicine. The objective of the Stop Chagas study was to evaluate for the first time the efficacy of the combination of two drugs in eliminating the parasites in asymptomatic adult patients. The multicenter and randomized clinical trial was carried out with 120 patients from 90 centers in 5 Latin American countries and Spain. These patients were divided into 4 groups that received treatment: placebo, benznidazole, posaconazole, or both. For 60 days, the continuity of the presence of the parasite was determined by molecular methods after 6 and 12 months. The results showed that posaconazole was very effective in eliminating the parasite in the first 60 days, but the effect was not sustained, unlike benznidazole, whose effect was maintained up to a year later in 87% of cases, 100% of those who finished treatment. However, 30% of the patients treated with benznidazole had to interrupt the treatment due to the side effects of the same. The combination of both drugs did not present any added advantage compared to the benznidazole monotherapy.
In the cell membrane is a lipid bilayer with proteins embedded in it. Ergosterol is the major sterol synthesized by 14-alpha demethylase enzyme that provides stability to the membrane. Glucan synthase complex, located in the cell membrane, is responsible for synthesis of beta-1,3 glucan chains. Elongation and cross-linking of the glucan chains with chitin imparts toughness to the cell wall. The azoles have broad-spectrum antifungal activity. They impair ergosterol synthesis by inhibiting the fungal cytochrome P450-mediated enzyme 14-alpha demethylase, inhibiting demethylation of lanesterol and accumulation of methylsterols. Lack of ergosterol leads to disruption of fungal cell membrane. Amphotericin has a high affinity for ergosterol in the cell membrane. Several polyene molecules get inserted into the fungal cell membrane as aggregates after combining with ergosterol to form a micropore through which amino acids, potassium, and other water-soluble substances move out. Echinocandins inhibit the synthesis of beta-1,3 glucan, which is required for cross-linking between chitin and beta-1,3 glucan that gives toughness to the cell wall.
Pros and cons. First, in Chagas disease, it is now that nifurtimox and benznidazole are effective in congenital infections and children infected by syphilis. In adult patients, different studies have shown that benznidazole appears to be effective in controlling infections and in clinical progress, but this must be demonstrated by clinical investigation. Cons. The side effects caused by the use of these two drugs threaten the life of the patients. Therefore, this result underscores the need to find new drugs or alternative regimens that help reduce the side effects of benzoyl or improve the effectiveness of treatment. Issues apply to medical. However, it is difficult to know the true epidemiological situation of disease. Its implications and its potential regarding its intervention are there are two terms currently used to base intervention. What likely is the value of the development and different comparable institutions and as the device conclusions. Some showers could be however, a number of significant organizations preferring treatment relative practices and results and how China competes as individuals. And this divided for more than the alternative to benzoyl and are able to relate to treatment. But benzoyl
I'm Peter Block in Chicago at ACC 2016 for On the Scene. And I will bet you that not many of you folks out there are struck by terror when you think of Chagas disease, but I will tell you in Venezuela and in Colombia, it is an ongoing problem and there's a lot of people in the United States who are positive already. So with me is Carlos Murillo from Colombia, actually from McMaster, right? And Carlos has done a very interesting study on therapy for Chagas, which will be a very important bit of information for all of those treating this disease. So Carlos, tell me about the study to start with, and then we'll talk about outcomes.
Yeah, well, this was a study we did in Colombia, Argentina, Guatemala, and Mexico. And basically what we wanted to do is test a drug that's called posaconazole. That is an antifungal drug that's been in the market for a long time, but just by serendipity, it was seen that it has good activity against T. cruzi, which is the agent that creates Chagas disease. And we wanted to compare it alone and in combination with benznidazole, which is the standard medication that we use for therapy, but that unfortunately has a lot of side effects. So what we did is that we did a proof of concept trial in about 120 patients, 30 per group, and we randomized these patients to either the posaconazole alone, placebo, benznidazole plus posaconazole, or benznidazole plus placebo.
Okay, so who's the winner?
So actually the winner is the old guy. Benznidazole actually had a good activity against the parasite that we detected by looking at real-time PCR, so we're detecting DNA of the parasite. By 30 days, almost 95% of the patients that received benznidazole alone or in combination with posaconazole were negative. And they maintained negativity for a year. Now, in contrast, posaconazole had good activity in the first 30 to 60 days, which is when treatment is given only for 60 days. But once treatment was stopped, almost 80% of the patients became positive again, which means that probably posaconazole has a trypanostatic effect and not trypanocidal.
Okay, so let me ask you a cardiology question, because